I wanted to thank everyone for being here today. As part of our fourth annual event, as Don mentioned, our showcase keeps getting bigger every year. And with the speakers and panelists we have with us today, I'm sure we will continue to build on our already strong tradition of success. Before I begin, please allow me to acknowledge a few people that make this event possible, starting with Dr. Sebastian. Don, without his trust in me and Tom, my partner, to get this thing done, we wouldn't be here where we are today, and I thank him for that very much. I believe you can tell by his opening remarks that he's very passionate about everything that we've done together. And 10 years ago when I walked into his office with legislation in a small box that said that if we apply for this extension program, we can help physicians move from paper to technology, and he accepted that, and we were the most successful regional extension center in the country. And because of that, I thank him, and that's why we're here today. Linda, who is president and CEO of New Jersey Healthcare Quality Institute and chair of the advisory board, thank you so much for all your guidance and help. Judith Shaft, who's also here, and is the associate vice president of technology and enterprise development at NJII and NJIT, for her work on our Innovation Showcase contest, and you'll see the winner of that contest at lunchtime. Our keynote speaker, Dr. Richard Barron, President and CEO of the American Board of Internal Medicine. Dr. Ashish Atreja, who is the Chief Innovation and Engagement Officer for the Icahn School of Medicine at Mount Sinai and co-founder of RX Health. All of our breakout session leaders and panelists will be sharing their insights on innovations taking place in healthcare today. And all of my team at NJII, I could not be more proud of the work that we do. I don't say this enough, but my team is one of the most dedicated, professional, and skilled group of people I have ever been associated with. So congratulations to all of you and for your work in improving healthcare in the state of New Jersey. Also, allow me to thank our innovation partner, Hackensack Meridian Health, our sponsors, the New Jersey Academy of Family Physicians, the Children's Specialized Hospital, Riverside Medical Group, Horizon Blue Cross and Blue Shield, CarePoint, and our exclusive media sponsor, NJBiz, for making our event the best it could possibly be, and for funding all of the food that we are having at our showcase. And finally, I want to acknowledge two more people who are here today, our Manager of Administration, Carly Creco, and Tyler Hausman, the Vice President of External Affairs, works with Linda. And let me be clear, without the work of both Carly and Tyler, this conference would not be taking place, and I thank both of you for all of your work and efforts making this program a success. Thank you. Okay, enough thanks. Our last innovation showcase took place in June, not that long ago. And I remember at the time taking some of the accomplishments that NJII had achieved since our inception, how fast we were growing. And I am pleased to tell everyone that that execution of our plans are well on their way and that our industry shows no sign of slowing down. Take, for example, the Garden Practice Transformation Network that is in its third year of a 4-year program. For those here who are not familiar with the Garden PTN, it is part of a nationwide CMS initiative to transform physician practices from fee-for-service to fee-for-value, with the goal of nationwide healthcare savings of more than $1 billion. Garden PTN allows us to support nearly 10,000 physicians and impact the lives of more than 500,000 patients. When the program started, we committed to CMS that we would save $155 million in healthcare costs while simultaneously improving quality of care. I am pleased to inform everyone that although we are still validating some data and processes, it looks as though we will soon be able to report to CMS savings of more than $122 million in total cost of care and 12 months ahead of schedule. For those of you that have ever had a CMS grant, it is grueling, grueling work. And the thanks that I gave the team before, it's all about them being able to accomplish this. Our data management capabilities and coaching programs are designed to reduce physicians' administrative burden and maximize the capabilities of their practice with information so they can be successful in a non-fee-for-service environment. On the innovation front, our Innovation as a Service program, led by Tom Bartiromo, has been up and running since last summer, and our partnership with Hackensack Meridian Health is in full swing. And Tom is doing a great job working with the health systems across the state, helping them make their innovation goals reality, making those ideas and those dreams come true in terms of products and problems to be solved. NJII just this past fall received its first installment of a $40 million grant from the New Jersey Department of Health and the Department of Human Services to manage, expand, and improve interoperability in New Jersey through the New Jersey Health Information Network, NJII. The network will ultimately enable all of New Jersey's 9.5 million residents to be part of a master person index, which will create a unique ID, which will identify you and ultimately pull your records wherever you go to the hospital or doctor anywhere in the state. This statewide project will improve safety, reduce unnecessary testing, help eliminate fraud, and save untold millions of healthcare costs. NJII is the state-designated entity for health IT, and many of the improvements that are taking place as a result of our work would not have been possible without the support of our funding partners, DOH and DHS, as well as Eileen Troutman, the CIO of the state of New Jersey, Department of Health. Considering everything that is taking place in our iLab, I can tell you that we are working at full speed in order to keep pace. Since 2015, the number of employees have grown from 12 to well over 100 today. And our top line revenue has increased from $500,000 to nearly $30 million a year. And while I get to stand here and take credit for all the work, it is really the entire team that makes this all happen. Our success is a testament to everyone's hard work. Outside the walls of NJII, there could not be a more exciting time to be involved in healthcare. As an industry, we have been notoriously slow to adapt, change, utilize, and accept new technology that would improve health and lower costs. But I, along with many others, believe that that is all about to change. Think about it a minute. Life expectancy in America has gone down for the second year in a row, something that was previously unheard of until recently. And 60% of life expectancy is associated most directly with your zip code, not your genetics, not the care we receive, but rather where we live. And there is rather dramatic move afoot to bring healthcare back to the local community as much as possible. Take, for example, the merger between Aetna and CVS. The $69 billion merger will revolutionize the way Americans shop for and receive healthcare. Right now, Aetna is the third largest health insurance company in the nation with 22 million members. Combined with CVS Health, that has 10,000 pharmacies and clinics, 5.5 million members, and 23% market share, and you have roots for a health ecosystem that becomes entrenched in your local community. In fact, CVS CEO Mark Bertolini was recently quoted as saying, "Call it 10,000 new front doors to the healthcare system." Proponents of the merger would argue that healthcare consumers would be more likely to visit their local pharmacy to get answers about their health and coverage, and that walking into a CVS health clinic is far better than walking through the door of your local hospital's emergency room, where the cost of care and burden of our system are exponentially higher. While opponents of the merger would cite fewer healthcare options and potentially higher healthcare costs, personally, I disagree. I remember the days as a child when my father would go to the pharmacy to get direction from the pharmacist about anything that he was concerned about with me or with him or my mom. And I think, and I believe that if there were a doctor there, that we'd probably go to the doctor there because it made it more convenient and the trust was there. The community effect of this relationship will be very big on, and disruptive to our ecosystem in healthcare. I also think that the recent interest in healthcare shown by several modern-day titans of industry will force positive disruption to occur. Take the recently announced partnership between Amazon, JP Chase, and Berkshire Hathaway. These companies are going to apply their unique expertise to a collective of over 1 million employees to improve their customer experience, improve the quality of care that they receive, and reduce their annual healthcare costs. And while large insurers and health systems for many years have insured their employees, what differentiates this opportunity is the sheer size of the number of employees that are involved and the ability for these companies to refer back to Deming, can manage what they measure, to reduce costs and engage consumers in new and innovative ways. While I believe that major innovations will start internally within these companies, the real momentum will occur when these corporate icons take what they learned from their experiences and move them outward. Just think about what could happen. Based on the talents of these companies, I could see a future where a patient data, including blood pressure, cholesterol, HbA1c, and other common health conditions, are seamlessly tracked and used to ensure patients have everything they need to take care of themselves right at their fingertips when they are discharged from hospitals, clinics, or providers' offices. Or Alexa, with a simple voice command, could make your doctor's appointment, let you know your prescriptions are due for a refill, refills, which, by the way, could be delivered to your doorstep by drone. These are all real possibilities for our collective healthcare future. The impact these companies will have on the consumer experience is undeniable. But let's not forget how the provider may fare in all this as well. Take the millennial physician, for example. He or she has long since abandoned the practice of scribbling notes on a chart and is expecting much more than the typical electronic health record can provide. A perfect example is Dr. Omar Baker. Dr. Omar Baker is co-president and chief quality officer at Riverside Medical Group that provides care for more than 250,000 patients in Bergen, Essex, Passaic, and Hudson counties, and who is one of my newest members to the External Advisory Board. He noted to NJBiz in a recent interview, and I will paraphrase, "Fitbits are bright, shiny objects and serve a purpose for those who are buying them. But until they are interoperable with EHRs, they are not all that valuable to the physician." Well, when you bring together the talent of Amazon, Berkshire Hathaway, JP Chase, you will believe that a solution to this and other similar healthcare problems might be right around the corner, and that physicians like Dr. Baker will be able to capitalize on the new technology to improve health and lower costs. To sum things up, the healthcare landscape looks brighter now than at any point in the past. Our corporate tech giants are bringing their collective skills together to healthcare with physicians like Dr. Baker helping lead the charge. We should all be excited about where our industry is heading and the advancements that will be made in improving the health of residents of New Jersey and the nation. Thank you.